And now we are about to listen to Anders Ekholm, who is Deputy Director from the Institute for Futures Studies in Stockholm. We will learn about exactly what we just were asked about, technologies for autonomous aging, gains, risks, needs, and obstacles. Welcome.
Thank you. Thank you. Good morning, everybody. It's a true honor, and I'm very glad to be here this morning. I'm Anders Ekholm, Deputy Director at the Institute for Future Studies, and we try to look into the future.
First of all, though, if we go backwards 5 minutes, how did you react when you saw the answers of this question?
Well, in fact, I do have the right answer.
Oh,
and
congratulations!
Yeah.
Wow! Please tell us.
I'm terribly sorry, but most of you were wrong. But I will come back to that. Anyway, I used to be the chief analyst at the Ministry of Health and Social Affairs, and I will start with some results from a project that we did at the Ministry, and then I will talk about the technology for autonomous aging. But the first question is autonomy interesting? Is it important? And yes, it's crucial. And it's not just that we like autonomy or that we like control in our lives, but this is actually a matter of life and death. In the Whitehall study that studied civil servants in England, the mortality rate differences between those with lower pay grades compared with the highest pay grades was a factor 3. So the mortality rates was 3 times higher by in those groups with lower control. And we do know that the perceived welfare for an individual is really it's really important with control in your everyday life and autonomy. So autonomy, yes, it's very, very important. I'm going to speak a little bit for gains, risks, needs, and obstacles about these technologies for autonomous aging. But first, some background. And the background is the demographic aging, of course, that we have. In 1751, we died a lot. This graph shows we died as 0-year-olds, so it was really popular to die even up to the age of 10 years. But if you had succeeded to survive the age of 10 years, you see that the most common death ages was about 60 or 70 or even 80. So we did become very old even in the 18th century. Then over the decades that follows, nothing much happens. It's a bit famine or wars or stuff like that. It jumps up and down, but nothing much happens until you reach the 20th century, where things start to really change. And in the end of the century, this is going forward, and within 100 years, the death graph is going to look substantially different. And what happened in society? For decades, nothing, or for centuries, nothing happens. Well, what happens was that technology struck Swedish society. The Industrial Revolution made us do better and better technology, and at first it was more of hygiene. It was clean water and sewers and stuff like that, better workplaces that drew on the longevity development. Medical care, for instance, or the medical technology wasn't that a huge impact on longevity during the 20th century. About 10% of the increase in longevity is due to the medical technology, and the rest, the 90%, is due to other technologies and the society as a whole, the welfare state, and so forth. Oh, sorry. What will happen? Well, nowadays, the medical technology provides approximately 25 to 35% of the increase in longevity. And of course, within 100 years or in 1,000 years, 97% of the longevity increase will be due to medical technology, of course. So technology is really, really important. When we look at this, we want to see not only whether people get healthier or worse, but we will also want to see whether people can pay for this health care that they would like to have. And in order to do this, we do simulation with micro-simulation models. This is done with a model called SESIM, which comprises 300,000 individuals from the Statistics Sweden's registers. And we have here two scenarios: the compressed illness. When you're 65 years of age in Sweden today, you can expect to live an additional 20 years, 15 years in good health and 5 years in bad health. Statistics Sweden, they forecast that by 2050, then we can live an additional 2.5 years as 65 years old. And we put this as healthy years, so you can live for 17.5 years healthy, but then we also compress the illness period in the end of your life. So basically you live almost 20 years in full health and then a couple of years in bad health. This is a little more positive than what we can observe in real data for Sweden. So we are getting much more healthier as individuals, but not this healthy. So this is the positive scenario. On the other hand, we wanted to have a hellish scenario, and this is the Lancet scenario, and it's based on an article in the Lancet, which stated that half of the population that is born today is going to live to their 100th birthday. So we tweaked our mortality matrices, and we got a population that could fulfill this goal. But we also said that, okay, you're going to be ill as today. So they are ill as today, they have disorders as today, but they never die. So this is a truly devilish scenario, especially from a cost perspective, but probably from suffering and so forth. And of course from population health perspective as well. We don't actually believe in this scenario because it's not that likely that we're going to be this ill and live that long. So it's not that possible. But anyway, we would like to have the gaps between the hellish and the good scenarios. And when we run the models, we can see how the society, how the population is aging, it is rising. You can also see that the darker the color, the worse the health. This is the populations born, the cohorts in the 40s, the 60s and 90s. And we can see, especially in this case, how the population is aging and also how the amount of illnesses is building up. Of course, and this is the ladies over 105 years of age, so we have to put them sideways because they didn't fit in the graph otherwise. And you can see the men, we are not that old anyway, but we are increasing our longevity, and the gap is closing between men and women. I mean, this is the real inequality between gender, that you are supposed to live an additional 3 years over us. That's not very good, is it? Well, someone should address this. Anyway, the results. Well, by 2050, the cost is expected to rise for the elderly care by 70%. By demographic reasons, the healthcare costs increase by 30%. But if you also put into the increased ambition that we traditionally put into healthcare, and also there's some talks about the healthcare paradox, that technology will drive costs. But as an economist, we see technology in other sectors as rather cost containment factor. So what has happened in other sectors is that technology has given us more choices, more products, larger volume, and steeper decreasing prices in every sector. And we think that why wouldn't this be true in the healthcare sector as well? Anyway, somewhere around 70 or 80% increase in costs for elderly care and healthcare. That is, of course, a challenge. And you can you have 3 ways of meeting this challenge. You can put in more money into the system, out-of-pocket payment, taxes, or insurance systems. That's basically the 3 ways that we finance the healthcare sector. Or you can withdraw the public financed output of services by cost cuts. which is another way of privatizing various diagnoses and so forth. But you can say, no, there won't be any heart transplants or brain transplants or whatever. You can't have it, or you have to pay for it privately. Or you can improve efficiency. And as it turns out, even if you can get hold of this money, this kind of money, which we think is politically very, very hard, you can't get hold of the staff. This is the prediction of the staff shortage only in the elderly care by the year 2030 per region. And it turns out that somewhere between 1 and 2.5% of the total working population has to be employed in the healthcare sector to produce healthcare the way we do today. So this is one of the main conclusions. One of two main conclusions. The first one is that we are not right. This is not predictions, of course. We cannot predict the 2050. So we will be wrong. But this is a scenario showing what will happen if everything works as today. And the second conclusion is we cannot produce healthcare and elderly care the way we do today. We cannot produce healthcare and elderly care the way we do today. Because even if we can get the additional funding, we won't get the staff. So we have to do something fundamentally different. And what can we do fundamentally different? Well, we can work with autonomy, of course, which is really important. This is really important not only on the individual level, but also on a societal level. Here we can see the World Value Survey, which is coordinated from the Institute for Fututes Studies. And we can see that the self-expression values, that you want to execute your freedoms, you want to choose stuff and so forth. And you can see Sweden is an extreme population. We are the most individualistic population in the world. And for every wave of this World Value Survey, we have to increase this box as the Swedes are getting even more individualistic. And the rest of the world is following. Well, it's not following Sweden as such, but when you have a higher standard of living and you have more education and so forth, this is ongoing development. So autonomy is really important and increasingly so. So we have to work with autonomy, and we have to give means and measures to the population to fulfill their health goals with autonomous technology. And of course, in all these aspects, for medical, in nursing, and daily life activities, and using care during care episodes, and cognitive autonomy is important in every aspect. And there's always also different various technologies that could fulfill this goal to help us to reach autonomy in these different aspects. And is technology important? Yes. As I said earlier, this impact, you can see it yourself in the death rates and in the death graph. Technology is hugely influential. We usually don't think about technology. We usually think that, oh, we do everything like we did. We should do this even if we were living at the Stone Age. But that's not true. We would not have these type of meetings if we didn't have technology like the PowerPoints, or if we hadn't had technology like writing and so forth. If we didn't write, we should probably have more meetings where we would sing, because singing is much more easy to remember long texts by. So singing and lyrics would be much more present if we hadn't invited writing. And maybe that would be a nice thing, actually. So technology is paramount, but it's also almost everything. So technology is the result of the development of the society, as well as the catalyst for this further development. As you could see again in the development of the death rates, it is profound, really profound. And you could, of course, think about technologies and what new technologies are emerging right now. Well, we have the Internet of Things, that everything is going to be connected to the net. So not just your smartphones, but also the different sorts of gadgets. You have sensors in your body or on your body. Almost every one of us does have activity sensors in our smartphones, for instance. So already today we have internet-connected activity measurements that actually can give you a rather good picture of your activity level in your life. And this also going to explode in data, in self-measurements. And the quantified self-movement, they are extremes, but they are also the first movers. So they have a lot of data of their own health, their lifestyle, their activity, their diet, but of course the level of D vitamins, testosterone, and so forth, all various biological markers, and they collect this data on a grand scale. Me, for instance, have this personal weight measurement that is connected to the internet. So every morning I get up and I stand on the scale and I scream a little. And then this data is connected to the internet, and then it's rerouted to my smartphone, which has this activity measurement. So my daily caloric consumption is calculated by today's data, today's measurement, not the average people in the 50 years of age or something that the healthcare normally has, the rules of thumbs or something, but actual data right now. But also decision support systems, and not only for the professionals, of course, but also for us as a private citizens. And daily life support systems for memory or lifestyle. For instance, my activity support system, it sends me SMS and emails every now and then. It says, well done, Anders, this is your millionth step taken. You're half the way to the moon. Well done. And I do know that it's a stupid server somewhere in the US that sends these messages, but still, I'm getting a little bit happy. And we do know from clinical studies that actual automated responses for dealing with pain or dealing with lifestyle changes is actually working. We are quite stupid, actually, but it does work. And of course, robotics, welfare robotics, that can come in when our bodies can't do the work anymore. We will have robotics that can replace our various obstacles. And the new Jeopardy Grandmaster is no longer a human being, but it's the IBM Watson system. So in 2010, Watson won the Jeopardy tournament in the US by beating the former 2 Grandmasters in Jeopardy. And Jeopardy is it's not that easy to do. So you have to understand natural language, you have to understand jokes, and being a bit funny or peculiar in your way that you formulate this. But Watson can actually do this. And what has Watson been doing since he won the Jeopardy, the Master Tournament? Well, he has been lurking about in a cancer clinic in Manhattan, trying to figure out diagnosis and treatment strategies for patients. And this, of course, when Watson becomes more mature and in more areas. Well, today, Watson is a decision support system where the doctor has Watson, and then the doctor and the patient sits down and decides together what type of treatment you should take. But then, of course, if Watson is with you in your pocket 24/7, every day, every hour, you can ask every question about your health. Watson knows everything what you do, all the sensor biometrics and so forth. Are you really going to have take the time to meet a doctor to have the answers? No, you won't. Gradually, Watson will do what the doctors does for us today. So we're gradually bypassing the doctors. And this, we're getting cognitive function that we couldn't dream about. Because when you ask Watson about your personal situation, Watson will scan like 250,000 scientific papers, all the clinical guidelines in 10 languages and so forth, and come up with an answer that is personalized to you. And no human being can do this, of course. We cannot read 250,000 scientific paper, not even through a whole lifetime. So Watson has capacities that we can't have, that we as human beings can't have. And of course, if our body gets weaker, we can have this type of exoskeletons. This is HAL, a Japanese exoskeleton. Every circle here is an electrical motor. There's small pads glued to your skin where they sense the nervous signals and then enhances this and enhances your motoric strength. So if your muscle strength is declining, you can have this stuff. There are also experiments with coupling this type of exoskeletons directly into your brain, so you can actually have paralyzed people to walk again. This is really Jesus machines in a real sense. And of course, every arm here can lift about 70 kilos, so the frail elderly can walk down to the grocery store and buy 140 kilos of cat food without help or any help from the elderly care. So this is really increasing our abilities. And of course, the US Army has this type. They look much cooler, I can assure you. But the American Army, they can one soldier can load 25 tons of ammunition before going to afternoon tea, or going into demolished houses and so forth. So this is really happening right now. And of course, when you're getting worse, this is Bestick, an eating assistive device. It's invented by a guy in Västerås that has polio himself, and he don't want to have to ask people for help when going to the restaurant. So he invented this. Again, autonomy is extremely important. He would like to could feed himself, not having to get help from others. And what is the gains? Well, when healthcare turns into IT, there's going to be an exponential shift. You know Moore's law, that every 18 months the computers are doubling its capacity. And of course, Watson, every 18th month, Watson can handle not just 250,000, but then 500,000 articles. And 18 months later, it will be 1 million articles and so forth. So it will be exponential growth in handling knowledge. And healthcare is almost all about knowledge. It is about information. If you go down to a hospital and see how many hours do people actually meet patients, and you will be surprised how few hours it is actually that people actually meet with patients. All the other time, they are quarreling with their neighbor clinics who has the most beds or empty beds or something, and they're doing a lot of other stuff than actually meeting patients. So healthcare is about information. And the great and the grand problem that every healthcare system has, namely coordination. All coordination is information. And in a complex system, after a healthcare system, we cannot coordinate this complexity manually. And of course, we will fail. And it's evident in all the healthcare systems all over the world that we are failing to give the more complex patients a good care. So we can have more secure care, monitoring warnings, and equal care. We have a lot of focus on equality in care, but it's not possible without decision support system. And the easy answer why it's like that is, of course, that the variance of experiences, the variance of equipment in hospitals in a sparsely populated country, for instance, is huge. So you can't have equality in healthcare delivered. It's impossible if you don't ramp up the technology. And of course, it's important for mental as well as physical well-being. Well, the risks, they are linked more to old technology, as are the costs. In a given moment, we do 99% of all the healthcare delivered is the same as the previous year. Just one or maybe a half of a percent is new technology. And of course, the big cost is among the 99% technology. So getting rid of old technology is more important than being aware about the cost for new technology. But what is the obstacles? Well, it's the great and problem on a system level. We have to have laws that could provide you with a regulatory framework to do this. You have to IT maturity of the government. The public sector is ranked 16 in Sweden, but the private sector is ranked 2. So we have a very IT deficit in the public sector in Sweden, for instance. And the organization processes have to be re-engineered, and the business models. And the staff is almost always the largest obstacle in introducing new technology. But not IT technology, because on the level we are today, this is high-tech during the 70s. So most of the stuff that we do in healthcare, not the Watson, that's high-tech actually, and also the robotics. But the patients, they are not the problem as well. So we'd like to have new technology. Most of us do. And we'd like to be introduced. And almost always when someone says that, no, we can't learn the old people iPads, the old people, they actually say, whoa, that's exciting. I have never seen one of those before, and I really want to try it. But the staff says, no, we cannot teach them this. But it's basically wrong. But when we have all this high tech, when we have this huge knowledge by our fingertips, In the future, I think the patient will think that the grass is greener on the other hand on the fence. So in the future, healthcare will be delivered by a primary practitioner coming home to your home with a doctor's bag, a nice bow tie, and probably a 19th century mustache. Thank you.
Although you're not a king, I suggest that while Richard is asking that you all stand up, because we've been sitting a long time.
Oh, yes.
So just to breathe. Yeah, because you had a few questions there. Yeah.
I'm honored.
Yeah.
So at last, you have the answer you deserve.
Finally. Yes. Thank you, Anders. Fascinating presentation. But as you can anticipate, it raises as many questions as it does offer solutions. You dealt with some of those in the very last slide. One of the things you mentioned was that the public sector has a deficit in information technology. One of the questions I wondered about is that most of the innovation that you are showing us in technology will be developed in the private sector. They will be private sector driven in terms of the way that they are defined. And yet they, in the Swedish context, if they're going to be effective for the elderly, if there's going to be still equity of access and so forth, they're going to have to be implemented by the public sector. So it's going to be built by the private sector, implemented by the public sector. Isn't that going to create tension and problems? How do you fix that?
Well, basically, it is going to be a problem. It is a problem. So basically, the inequality is increasing. And when the new technology can be implemented by those who has the resources, mental or financial resources to use this technology, the inequality will increase. So, but it will increase because that the healthcare sector cannot implement this type of...
Well, doesn't it require the healthcare sector to be much more flexible than it is today?
Definitely, yes.
So there has to be a change inside the healthcare sector in order to absorb this new, these new possibilities.
Definitely. So you have to work with the inner efficiency in the healthcare sector, that is being more efficient in doing what you are doing in your everyday healthcare life. So you're more and more effective in doing the same as yesterday. But you also have to be more effective in your outer efficiency and efficacy in English. That requires experiments. You have to take risks. You have to, and you won't going to succeed. So
and that sounds like it's quite different than heavy regulation. It also sounds like it raises questions about equity because you'll have different rates of development in different counties in different parts of the country.
Absolutely.
Okay. So that raises one question. I had one more question, which I found interesting, this notion that the elderly want more self-control and therefore they will have a robot to take care of them rather than a human being because labor is going to be too expensive. Of course, that ignores the factor of immigration and the needs for jobs from people from lower income countries and the way in which you have cross-border transfer. So there's a question there. But what I wondered about, and I suppose this is the question that I suppose a number of older people might ask, but if the machines are going to become smarter and smarter, if every machine is going to become Watson, and I have the brain in my pocket, what's going to happen to the brain in my head?
Yeah. Well, it will...
is it going to atrophy? In other words, are we going to become stupider and stupider as the machines become smarter and smarter? There are some unkindly who say that's happening to the younger generation today.
Yes. They have always said that about the younger generation since 2,000 years back. But
technology is always changing.
Yes, technology is always changing. But if you build Watson very smartly, then you will build Watson that it so that he challenge you to think about stuff.
So Watson's going to be a problem in my pocket, not a brain.
Yeah. So you will perceive Watson as a problem, but in the matter of fact, he will be helping you to regain your mental.
Well, because as we
capacities.
heard about dementia, one of the fundamental issues is making sure people use their social and mental faculties. If you just rely on a robot or you rely on a Watson pocket model, obviously you use your faculties less and less, which means it speeds you toward dementia rather than reducing it.
So obviously you have to build the systems not to substitute you, but to empower you.
Supplement.
Yeah, not
Power.
to supplement.
Okay, so an empowering robot.
Yeah. So
Could
empowering.
even be a coach who would
more like
remind you of
Absolutely. And
avoid that and how to walk.
sort of, and since it knows when you're in the elderly, in the nursing home, for instance, when your friend is going out, your exoskeleton would jump out of the wardrobe and say, "I want to go out too. It's so beautiful weather today." So it can actually emphasize
Will this exoskeleton have an off button?
No. No, it will pick you up and go out with it, whether you like it or not.
That's what I worry about.
Thanks a lot.
That could
Enjoy it.
speed death.
Thank you very much.